I don't know if you can hear me or see me. Hello. We have to wait a few more minutes for Dr. Sleiman. She will get here any moment now, and she will go over the syllabus and what is expected of you in respect to the PowerPoint presentation. So let's just wait a few more minutes for her to arrive. In the meantime, I hope everybody can join. We're only at 100 people capacity right now, so let's just hope that in the next few minutes, more people will join us.
All right, we have most of the class here. It's showing that I have, well, the number is going up, 115. So, all right. Hi, Dr. Anderson. Hi, Dr. Griffin.
Hello.
How are you?
Good. We're doing good.
Good afternoon.
Thank you for attending the orientation session. Dr. Schmutzer, are you on?
I'm on. Are we recording the session?
I will record it once we begin.
Okay.
Let's kindly ask everyone from the participants to mute themselves, and also moderators, if you please can. If you'd like to add something, just turn on because I can hear the echo. All right, so I'm going to start the recording of the session so that we have it for those of you that are not here. Hello? All right, everyone. I believe the recording is on. We're going to go ahead and begin. Thank you, everyone, for your patience. So we're going to be going over this part of your syllabi, which is Appendix 6. This is the component where you will be presenting on a actual patient case from your patient pool. There are some criteria for the case selection that we will go over as we go through this. So some important things to keep or to save if you're having a patient, if you have a patient or you've already done these before. Make sure you have either the original, well, the cast at this point, the original ones, we won't be able to have them with us in class because this class is going to be online. But make sure you take photographs of those mounted casts and take the intraoral photographs as well. And those are going to be added to your presentation PowerPoint, and we'll go over the PowerPoint after we go through this. You must have done, and this is a very important point, for the case to be considered proper for this presentation, you must have done the treatment plan, and it must be where you've done the majority of work on this patient. You either must have treated the patient and completed or almost completed phase 1 and working towards phase 2. So you have to have done some sort of treatment on this patient if it's part of phase 1, but you can't have the patient where you've only done on them the initial the oral component, the oral diagnosis part, and you haven't done any portion of the treatment yet. So it must be that you've done some sort of either partial of the phase 1, or you've completed phase 1, which is more preferable, and you're working towards phase 2. There are 3 sessions that you are required to attend. All 3, one of which you will be a presenter at one of those. The schedules and the assigned dates for presentation and participation are posted on Blackboard, and I will share with you my screen after we go through this form of where to find that information. Up to this point, Dr. Kashani has posted the 3 dates only. The dates are, the first date is September 18, September 25th, and October 2nd, and you'll find those on Blackboard. If you can't present on the date that you are assigned, you must find yourself a classmate that is able to switch with you and is available to present on that day. You guys have to talk to your classmates, see if anyone is willing to switch with you for those days. Otherwise, there is a deduction in your grade of 10% for failing to present on the date that you are assigned and the time, and this is going to be at the discretion of the course directors. For the participation, you are expected to read the articles posted for the sessions that you are assigned to participate in. The articles, I'll show you on a little bit on Blackboard where you're going to find them, where to post your articles. If a student missed, so a student will be given an opportunity to present a second presentation time if they have an excused absence, or if they failed this segment. And that's going to be like either at a future remediation date. Each student will present 1 case to your classmates from your patient family pool, as I mentioned before. And this should not be one of the cases where you presented this patient case scenario in another course for a grade. So please keep that in mind. It cannot be used for the medical complex write-up assignment that you have for geriatric competency or special needs competency, and you can't use a patient that you've presented in those 3 in this for this competency. So as I mentioned, you must have done the diagnosis, treatment, and majority of the treatment. It is preferable to have completed the phase 1 and working towards phase 2. The case cannot be a denture case. It can have an oral pathology lesion. If you have that, you would also include the full biopsy report, or a documented treatment plan or treatment failure. They must be fully documented, again, with photographs, radiographs, the study casts, the diagnostic data, the prognosis, medical and dental risk assessments, and any other problems. And of course, your treatment plans, phase 1, phase 2, any alternative treatment, or rationale for the treatment as well. So from this clinical case that you have on one of your patients, you're going to develop a question, and it's going to be in a PICO format regarding either the therapy prevention, diagnosis, etiology, or prognosis. And you are going to address this using the evidence-based decision-making process. Formulating a PICO question, you may refer to the Foundations of Evidence-Based Dentistry course. I have posted for you a template on Blackboard that has like a list of the different types of the PICO questions and a template for just a reminder for how to do those. In the chat, Carly's asking, so it has to have been an OD, or can it be a POE? Both we would have made the treatment plan for the patient, or I'm not sure. Can you expand a little bit? Both we would have made the treatment plan for the patient. So if it's not originally the patient that you were assigned, like it could be like an old patient that your upperclassmate might have had done the original OD, preferably it should be your own patient from beginning, but it depends on the case, and you must have done the majority of work on it. It has to be your own work, not an upperclassmate's work. I'm not sure if that answers your question. Okay, great, Carly. Rabia is asking, in regard to denture case, can the phase 2 include RTD, or can no dentures be involved? Preferably not, because we want something where you are showing not just like if it's phase 2 is probably going to be if you're looking at a denture that you've done extractions, so preferably not. What do we do if you don't have casts or photos? If you don't have the casts or photos, so on the rubric you'll see each one of those components is associated with the point, so you'll lose the points for the if you don't have the clinical photos, or if you don't have the pictures of the casts. Brittany, what if the D4 last year made the treatment plan, but we did all the treatment? Is that okay? I'm gonna have to refer to Dr. Kashani about that question, but.
What's the question?
I think it is. I think it's just the treat. Well, Dr. Kashani is here.
Dr. Kashani, she's asking if the D4 from last year made the treatment plan, but she did the treatment. Is that okay?
I have to look at the case because you need to write up the information on it.
Yeah.
I have to look at it.
Yeah. So I guess it depends on how much you were involved in developing the treatment plan as well at that point, Brittany. Okay.
The thing is, what happens is you need to have the original cast and you need to have intraoral photos. Do you have that?
If they don't have them, they just lose the associated points with those components.
Right, but the thing is, that's part of the presentation, where you were at, where you're here. I'll look at it, and if you have a question, please come and see me. Not a problem, okay?
Okay. So once you have that case that obviously the case selection is very important. The case must have, and I think it's coming up later on the image on the slide here. So Christine, where did you get this from, the Appendix 12?
From the syllabus.
No, this is not it. The one that's posted on Blackboard.
Oh,
hold on.
I'm sorry.
Let me just. You know what? Can I share my screen? I'm just gonna share my screen and go to Blackboard. There's just a little bit of additional information on the other one. I'll get back to the chat questions in a second. Let me just, can everybody see my screen? Just tell me yes or no.
I can see your screen.
You can?
I see you're in, yep.
Yeah, and Blackboard. Okay. So this is what we were going through. So this is what you can also find on Blackboard posted for you over here. So you will use this to develop the PICO question. Once you develop, you will use this patient case and select the case that you select to develop your PICO question. Once you develop your PICO question, obviously you have to conduct a literature search in order to find the appropriate evidence to answer your question. And I'll get to, in the section where it says post articles here, what are the appropriate articles that you can use, you may or may not use for evidence-based decision making. And I hope you all can recall that information from the Foundations of Evidence-Based Dentistry course. I know it's been a few years, but hopefully, you know, once you got just go back and review and refresh, and hopefully this will all bring it back. So the case must provide the opportunity to integrate biomedical and clinical sciences. So it must have at least 2 clinical disciplines and 1 biomed. And what we mean by that is that the clinical, you can have a case that has endo and restorative, and 1 biomed, like an underlying pathology. And I'll show you where it says sign up, biomedical topic sign up, a list of the topics that you can sign up for. So it must be presented in PowerPoint presentation. I also have posted for you a PowerPoint presentation template. This is just an example. We'll go over that as well, and along with Dr. Schmuchter. The student presenter, you must be able to answer questions from the audience and discuss the rationale for the treatment that you chose, as well as any other possible treatments that could have been as an alternative. As I mentioned, the dates for you are posted on Blackboard. We'll go over that as well. Once you select your article, you must upload it in PDF format. I emphasize that because sometimes, you know, we don't want students to post the link. We want it to be available in PDF format. So once you find your article, you select it, you upload it in PDF format. And it's very important that you upload it 1 week before in order to allow us, the faculty, the facilitators, and also the students participating in the room to have sufficient time in order to read the articles and prepare for the case discussion. Full points will be awarded when the case is submitted on time, basically it's the article. Late submission of the article will have 10% deduction and 30% deduction if submitted within 3 days of the presentation. So make sure you start working once you know the date that you're assigned for your presentation, that you select your article and you have it uploaded to Blackboard 1 week before your presentation date. The presentation, once it's complete in PowerPoint format, it must be uploaded in the final form to Blackboard 24 hours prior to presentation. And the reason we request that you have it uploaded to Blackboard 24 hours prior to presentation is that we as facilitators need to upload all the presentations for that day onto Blackboard. So we greatly emphasize and we greatly appreciate if you can have it ready and post it to Blackboard 24 hours prior to your presentation so we can upload it to the Blackboard Collaborate room. As I said, the students must read the posted articles for the session date to the room and that they are assigned. If you are not prepared for the discussion and you do not participate fully, you will receive a grade 0. If you do receive a grade 0, you must attend another session in order to remediate for participation. And if you join the online session late, more than 15 minutes, that will also result in the need that you participate in another session. So you can't join the session late because sometimes it's halfway through the first presentation and you miss the opportunity to participate in those. So you must attend at the beginning of the session in order to receive a grade for participating in that session. Okay. Posted along here, you're going to find, if you follow with me on Blackboard, you're going to find the seminar participation rubric, the presentation grading rubric, and also the PowerPoint presentation template, which we'll go over. There is a sample presentation that you can view. This is just an example. You can make much better presentations, I'm pretty sure, than this sample as well. Also posted for you, there's a template to help you formulate the different types of PICO questions. Let me go back to the chat to see if anybody has any questions. Does anyone have any questions? If you can please just ask the questions via audio, that would be great. Okay, let me go back here. Janine, we are confused about the intraoral photos requirement. We don't take intraoral unless it's an OD2 comp, and most people
Let me answer that question.
Yeah.
The intraoral photos are for the OD2 comp. That is correct. But this syllabus was given to you for the first set that you showed up in the clinic, and it really has, this part has not changed, and it has indicated that you need to have intraoral photos. You can take intraoral photos at any given point in time for your patient. It's part of the requirement for the OD2 comp. But also your patients, I know a lot of students have taken intraoral photos because they were presenting at the seminars. So that was the thing. It's not that, oh my God, I didn't do my OD comp too, therefore I don't have intraoral photos. So this syllabus hasn't changed from the beginning. Go back and look at it. It was the intraoral photos are needed for this, and the mounted casts. Mounted casts are needed for every case that you have, so it's not something new. So typically people, if they had a patient that had a lot of work that needed to be done, they did photos. And I've seen a lot of people have done photos, whether they were needed or not, as an OD comp too. So from that standpoint, if you did your OD comp too, you may have put photos. Some people still haven't uploaded their photos because I haven't seen them. But the thing is, this was part of the syllabus from the beginning. So this is nothing new. Thank you.
Okay. I hope that answers your question, Janine. Let's see. Cassidy, it seems that way unless you can schedule a patient who meets the criteria and say, okay. Lucas, what kind of cases are we supposed to be presenting? Like, do these have to be medically complex treatment plans? It can be, so as I mentioned, the case must have 2 clinical disciplines and 1 biomedical component to it. So if, as I said, like it could be, and we'll go over the biomed topics. Let me go through that right now to answer your question. So on the left-hand side of the Blackboard site, you're going to find a biomedical topic sign up. So you're going to click on that. It's going to take you to the sign up sheets. Once you know which room you're assigned, and that's under orientation and schedules, then you click on the date that you are assigned to present. So for individuals that are already know that they're assigned to September 18, 2020, they're going to click on this or the other dates available. And then you're going to click on Edit Wiki Content. And then you scroll down. No, cancel. Sorry. You actually just click on it, I believe. Why isn't it open? Oh, here it is. Okay, sorry, it took a few minutes to upload. So you're going to find a list of the topics. So this is the topic list. You can select a patient that has HIV/AIDS, if they have any respiratory conditions like asthma, etc. So once you select your topic, autoimmune diseases, cancer, neurological, diabetes, special needs patients, smoking, psychological, cardiovascular, blood disorders, transplants, liver cirrhosis, kidney dialysis, bone disorders, or MRANJ, what you're going to do is that once you select it, you put in your name, and then you put in the room number and the date of presentation. One important thing here is if a person assigned to the same room as you are has already selected a topic, then you may not present it. And the reason is we don't want redundancy. So if there's 4 presentations in the same room, we don't want them all on the same day to be on diabetes. So if a person has already chosen that topic, you may not, under any circumstance, erase that student's name and put your name instead, or remove their that they have put this. So it's kind of like you have to select your case, early on. Make sure you select your topic and you sign up for it for that room number. And the reason is we want to expose the students to a variety of the topics as much as we can, and we want to prevent and reduce the redundancy for presenting the same topic for that room, okay? So this is how you sign up for the biomed topic. Going back over here, just for those, the schedule posted so far is for the first 3 dates that I mentioned. So there will be 12 students in each room. 4 of you will be presenting, and you must attend 3 seminars. So attendance is mandatory in order to receive a grade for participation. Again, if you're present, it does not necessarily mean that you will be receiving a grade just for being there. You have to be actively participating in the discussion. Asking questions, answering questions, having read the article, those are considered, and proof that you have read the article, those are considered participation. You must, if you can't attend for participation, you must let the faculty in the room, it's either myself or Dr. Schmutzer, email either one of us that you are not going to be there's a reason for the absence, and we can set up a time for you to make up the session. You can't just pop into the room. So virtual walk-ins will not be accepted. And then the schedule will be posted and updated as we go forth, but this is the list of the students that are already scheduled for September 18th, September 25th, and October 2nd. So you can see here, these are the first 4 students are going to be the presenters for October 2nd in this room, and these are the 4 students that are going to be the presenters on October 2nd in room 2. And then these are going to be the students that are participating on that date, and these are the students that are participating on that date in room 2, and then so on and so forth. So if you scroll down, you're going to see the assigned names and rooms. So make sure you sign up for your topic and put the room number also. Let me go back to the chat. I hope I answered your question, Lucas. Christine, go ahead.
I'm sorry. I just wanted to let you know that last year there was a lot of confusion with people just showing up for participation on random days. Please do not do that anymore. If you really have a reason not to attend, that's perfectly understandable, but let us know and we will schedule you for another day. Also, you're only allowed to make up for the participation in the room that you are initially assigned to.
Yeah, you must remediate for participation in the room you were originally assigned, correct? Okay. This is the section
that came up about 4:30 p.m. Would this be at 4:30 p.m. every time? No. The reason we have this orientation at 4:30 p.m. because there was a pedo competency going on 1:30. It is done at 1:30.
Yeah, the class
starts at 1:30 and it goes to 4:30.
The class starts, it's on Friday for the dates, and it starts at 1:30 p.m. Okay. So for the article selection, as you know, for evidence-based decision-making, we cannot use low level of evidence. And I hope that you guys still remember what are the low level of evidence types of studies. So no in vitro, no animal studies, no literature reviews, no case reports, no case series, no expert opinions. These are not acceptable types of studies or articles to utilize for evidence-based decision-making. You may use medium or high level of evidence, and if you refer back to the Foundations of Evidence-Based Dentistry course, I can also post for you like a short summary of what types of studies those are. So like a cross-sectional study, a cohort study, a randomized clinical trial, a non-randomized clinical trial, those are considered medium and high level of evidence. You may present for this year's systematic review or meta-analysis study. However, you must select one article from that systematic review or meta-analysis to present in detail. So it does not suffice that you present just a systematic review. You can present it as a supplemental, an overall, but you have to select one of the articles in that systematic review or meta-analysis in order to present in detail and critically appraise, to show the limitations, the biases, and the strengths of the study. This is where you will post your articles. So if you are assigned in room 1, you click on this and you upload, as I mentioned, the PDF with your name and the date of your presentation to this room. And this makes it easier for us, the faculty, and also for your classmates to access the articles and find immediately, identify what date they're assigned and which articles they are assigned to read.
I just want to make a quick point regarding the systematic reviews. So systematic reviews, you can present the systematic review, but make sure that in addition to that, you present an additional study from the systematic review to present in detail with critical appraisal, and preferably that study should be one that is pointing towards the direction that the conclusion of the systematic review is pointing towards as well. So something that is in line with the conclusion of the systematic review. So you present 2 papers in the case you're choosing a systematic review.
Okay. Thank you, Christine. So this is where
I want to mention just one of the things that they said about the schedule. Tanya made the schedule all the way to the October 2nd. That's why I only have the schedule all the way out to October 2nd. As it becomes available to me, I have asked her to put you in groups. Your name is already, whatever I gave you already is an axiom. It's going to come up. Most likely we're going to go all the way to the end of February. December 18th is designated for remediation of the people that did not pass for up to December 11th time, and then we're going to have one at the end of February. In February, I don't know till Tanya gives me the schedule.
Okay. All right. So continuing on Blackboard, you can see here, if you scroll down, it says submit EBD PowerPoint presentation here. You click on it, and this is where you need to upload the completed and final version of your PowerPoint presentation. As I mentioned, 24 hours prior to your assigned presentation date in order to allow us time to upload it to the Blackboard Collaborate room. So I'm gonna stop sharing my screen and I'm gonna move on. Is there anything else you'd like to add, Christine or Dr. Kashani?
Yes, there are things that if you are in school in the morning and you're not gonna make it to home at 1:30 to get on Blackboard, what you can do, I still have reserved a couple of rooms that you can do a social distancing and sit there, or a smaller room that you can be in. If you're home, it's given that you're going to get on Blackboard. I tried to ask Tanya to not schedule you if you have a morning clinic, but it's going to happen because when we decided to do it online, then it left it a little bit more open. So if you're here, we need to find you a quiet room to put you in so you can be in there. I mean, multiple of you guys can be in the same room, but at the socially distanced level, so you can do that. But if you're home, you're home. So I just want to make sure that it's not going to be an issue, and I don't want it to become an issue.
Okay, just going back to the chat questions, Dylan is asking, do you want us to bring the patients in just for intraoral photos and lose an appointment time?
I would leave that up to you, because as I said, it was in the syllabus that is required for this to be there. If you think it's going to contribute a lot to the presentation, I think that's why the intraoral photos were designated, because people like to look at things to see what people look like. The radiographs may not be enough. And part of this is for you to, not only you have an EBD part, but also you need to present a plan of a case that you have diagnosed, worked on, and you can give us the good, the bad, and ugly that happened during the treatment. So that's part of this as well.
Okay. I guess there's more questions in the chat if you can address those.
So Lucas asks if it should be a PICO question that is relevant to the case. Yes, it should be relevant to the case, as well as the article should be relevant to the case.
Remember, Lucas, when you formulate a PICO question, you formulate it based on a clinical case scenario. So the question that you formulate has to be a question that you're addressing a concern in regards to a treatment selection, or what are the options for you for that specific patient. Let me go back. There's more questions in the chat.
I need to look at it because they're asking questions. Can we do an RPD patient that needs an RPD? It's not an RPD patient. If they have two other disciplines in phase one, you better have done, as I said, I know you guys are sharing things with your partners, but I want to see you have done the work on the patient, not that you got it from your friend and they did it and they presented it. By the way, it should not have been presented by your previous partner because we keep track of that too. So heads up.
So I don't know the people, the students that are asking about if our patient we received RPD in phase 2 but had multiple clinical disciplines, could they still qualify? Were you the student that did the majority of the work on them? Were you the student that did the OD and the treatment planning? What phase, like what have you completed in the treatment so far? So those are all questions that you would have to answer and see if the patient, if it would be an applicable patient, and as long as they have, like as I mentioned, 2 clinical and 1 biomed. Herman is asking if there are no photos, does that mean we can't use the case, or can we just take the grade deduction? You can use the case, but you will get the grade deducted for not having the photos. Can 2 people present about different types of cancers? Yes, if they are in the same room, but you must specify on the biomedical topic sign up what cancer are you talking about. Out of 50 points. Yeah, so Selwa, the answer to your question is the schedule will be posted as she gets it from Tanya. I guess you've answered all the questions. Is there any questions that?
They're talking about if the patients were here, patient of record before and they came back, you did the OD, then the thing is you should have done a lot of work. I mean, you should have done the phase 1, working toward your phase 2. So if they were a patient of record before, that's not going to be an issue.
Timothy is asking, how do we know if our previous partner presented it or not?
I believe you have the data from last year, Dr. Slayman. Am I correct? Because when they presented their cases, you put down the chart number on there. So we can check on, yeah, we can check on that.
So a question is, the only patient I have that qualifies for this doesn't have any medical conditions. So you have to review all the patients in your patient pool. Some students immediately think, oh, I don't have anybody that qualifies. So you must look a little bit closer at your patient pool population and see what is it that what is different about the patient. Do they have something? So that case that you're mentioning about the ibuprofen allergy, you have to look a little bit further into it and see, is it something that you can ask a PICO question on, and try to find evidence that supports to answer that question.
Ashley asking if you have a patient that only needs a scale planning, this is not multiple discipline. So there must be other things going on. It's just not scale planning. That's not going to work really well here. The other one is, can you bring a case to me? I can look at the case that you have I have no problem looking at it to let you know whether I think is a good case or not. But part of the selection is also something that you have to look at. But you need to have multiple disciplines involved, not just one thing. So keep that in mind.
Okay. So let me go over the PowerPoint presentation template. So we have, I think I failed to mention this earlier. So the presentation is limited to about 30 minutes maximum. It is not limited to 30 slides. So I wrote that here in red. There's no limit on the number of slides. However, you must keep in mind the allotted time for the presentation. And I'll post that on Blackboard. The presentation allotted time is 30 minutes. You should include the patient chart number, of course, your name and your date of presentation. You have to present the case as if you were presenting it to the clinician who's overseeing the treatment. So you have to talk about the medical history. Do they have any significant medical history? A summary of it. Are they on any medications? What medications they are? Why are they on these medications? And if you've sent out a medical consult, what is the patient's chief complaint? What is their dental history? So this is included under patient history, and it's not limited to one slide. You utilize as much slides as you need. Don't put everything and cram it on one slide. Of course, you have to make it aesthetically, understandable and readable as well. Next, you have to include the extraoral exam. Is there any significant findings of that? Their vital signs of the patients at the time of the exam, along with the intraoral findings as well, and if there is something significant on that as well. That's on the following slide. Okay, so if the patient has any soft tissue lesions, you should include those. This is the photographs, so having the occlusal view of the maxilla, the mandible, the right view, the left view. That's if you have those photographs or if you elect to bring your patient back to take those photographs. If you don't have the photographs, you can still use a case, but you will be deducted points for not having that component on the rubric.
It's 1 point for the photographs, for the oral photographs, and 1 point for the cast photographs.
Yeah.
So this is you're losing 2 points if you have neither one of them. You're losing 2 points out of 50 points total.
Automatically, yes. You must have the original diagnosis cast, the 5 views. Again, if you have it at home, in school, you take a picture of it and you add it up here onto the slides. Radiographs, any bite wings, panoramic x-rays that you've taken, you insert those radiographs onto the slide. And again, you have to talk about the findings of those radiographs as well. Dental charting. So on Axiom, you have the original charting, and I put it in bold here because this is the original charting before any treatment or progress was done on the case. So it's from the initial intake date of that patient, even though it was not necessarily your patient originally. You can go to Axiom and you go to the history and you can find the original date or the initial date of intake, and that's where you'll find the original charting, which you can take a screenshot of and include it. Just copy paste it into the PowerPoint. You have to include also the dental diagnosis, what the missing teeth are, and that's something you can explain off of the dental charting. Whatever you do, don't read off the slides. This is, of course, presenting just an overview with the number of caries, infection, and any space issues from when the patient initially presented.
So another point here, you will lose points if you don't have the original charting. Yes. For the charting at the time of treatment, you will, even though you have it there, you will lose points if it's not the original one.
Mm-hmm. You must include the caries risk assessment that was done on the patient, the factors that allowed you to determine if it's a high caries, low caries risk patient, etc.
Can I go there for 1 minute? Is for the caries assessment, do not copy and paste Axiom. For the treatment plan, do not copy and paste Axiom. You have to write it in your own word. Mm-hmm. For the perio charting, you can put the picture of the perio charting and then you have to write the prognosis of it. You do not copy and paste the Axiom form again.
But just for the dental charting, it's okay for them to copy paste?
Yes.
Okay. So this is what Dr. Kashani was talking about, the perio charting, the overall diagnosis. You have to be specific, of course, with the new criteria. What are the contributing factors, OHI, home care, etc. For the prognosis, again, predict the outcome, provide the prognosis, talk about or speak towards the patient compliance if there is any issues, discuss the longevity of the possible outcomes for the treatment. And of course, you have to present the objective. So what was the patient's objective? if there was an aesthetic function, plain or infection elimination. So you can put in here the chief complaint of the patient and what their objectives were. What is your objective as a provider? What do you want this patient to reach or achieve? And then you provide your treatment plan. So you're going to talk about phase 1, phase 2, prevention plan. If there's any alternative, or there should be always an alternative treatment plan, and explain the advantages and disadvantages. You have to take in the patient's consideration, because if you recall, part of the evidence-based decision-making is the component where you look at the patient's preferences and their needs. What was the rationale for the choices? And again, don't copy-paste Axiom. You have to use your own words for the treatment plan. Once you've explained and presented the case, you come up with a PICO question on that case. So PICO has 4 components: the patient problem, the intervention or exposure, the comparison, and the outcome. You must write it in the proper order, in the proper format. You have to state what type of question it is that you're writing, and you write it in full sentence. Now, the biomedical information on the topic, it's only 1 slide in this template. But as I said, you're not limited to 30 slides, but however, you are limited to the time of the presentation. Under biomedical information, you have to present what general knowledge about the clinical topic it is that, or disease that that patient has. What was it necessary for you to search to find specific answers? You can put in diagrams, charts, figures, anything that's going to help remind the audience of what the normal state is, or the pathophysiology in this condition, the microbiology, the immunology, and the pathology, etc. So you can utilize like charts, diagrams to explain the molecular events that are occurring in a certain disease, what are the changes that are happening, etc. Once you've presented the biomedical, then you have to conduct, based on your PICO question, you come back to presenting what was the search that you did. So you have to talk about what keywords that you selected from your PICO question, what databases that you utilized in order to find an article appropriate to answer your PICO question. So you're going to tell us from the data sources, what types of information were you able to retrieve? Did you pull out like randomized controlled trials? What types of studies? And then on the following slide, you're going to tell us which article you actually chose and why you chose that article. What led you to choose that article? Sorry, my laptop is a bit... Christine, can you advance it to the next slide? Okay. Oops. Okay, so this is the slide where you put in the evidence chosen. Right here. You have to insert you can, in this case, take a screenshot of the title of the article that you chose, because it shows the title, what journal it was published, the year, the authors, and the affiliations. So you can insert a snapshot as shown here. Now, once you have presented up to this point with the article that you've chosen, this is where you move forward into talking about the details of the study and the article that you selected. So this slide here, you present if there is a stated hypothesis or what the purpose or aim or objective of that study was. If there's no hypothesis, you talk about what the purpose or aim was of that study. So this is where you state that information. You move on to present what the methodology was, the study design, so what type of study was done. If it's a randomized controlled trial, you can speak about if there was randomization, if it was truly random. So you go through presenting the methodology of the study. Where was the settings? Was it done in a community, in a hospital? If it's a clinical investigation, was the study conducted in real life circumstances? So you talk about how the study was done, what subjects were recruited, how they recruited these subjects, who was included or excluded in the study, if they had any explicit inclusion/exclusion criteria listed, etc. You talk about the interventions, so if there were any interventions, if it was a clinical trial, or if it was an observational study, like a medium level of evidence, like a prospective cohort, you have to talk about what they were observing or how they observed, what was the timeline for the follow-up, etc. The methods, so what outcomes were measured, so what was it that they were looking to measure, did they do a follow-up, was it completed? If the assessment was done, if it's a case control study, the allocation of the cases, if they were blinded or not. In the results, once you're presenting the results, so sometimes they're going to have you're going to have an intervention where they have two groups. You talk about the groups, if they were similar or not. So there was were they treated equally? What are the key results? So in this case, you can take snapshots of the figures, tables, charts, clinical pictures, and any data that was presented. And one point I want to emphasize here is you do not pick and choose what data from the article to present. You have to present all the tables, all the figures that were presented or in the study, okay? And you should be definitely able to explain what the figures are showing and what is the importance of what they're showing in those figures as results. Finally, you present what the main conclusions of the study were, and did these conclusions support, you have to tie it back to the original aim and purpose of what the study sets out to prove or present. Now, for the critical appraisal of the presented article, you have to present the strengths, weaknesses, or any limitations. Were there any biases or confounding factors in the way the study was conducted? And this is a very important step in the critical appraisal process. So it tells you about how well the study was done, how reliable and valid the results and outcomes were from this study. And then finally, you have to tell us about how you took this evidence from the article that you presented, and did it help you answer your original PICO question? Can you take the results and apply them to your patients? Did it help you in selecting or avoiding a type of therapy with that patient? And were those results useful for counseling the patient? And this slide here, how case was treated, you present to us a reflection on what happened with the patient. You critique your own work, how everything completed throughout the process. You do a self-assessment, and obviously you devise a plan for improvement. So what is it that you would work on more in the future? If you have completed the treatment of the patient, so if you've completed phase 2, and if you have those, if you want to show us the clinical photos, the results from the patient follow-up, that would be great to include here if you've completed the treatment on that patient. And then finally, you have to list in proper format all the references that you've utilized in preparation of the presentation, whether it was the original articles that you presented, if it was any literature that you utilized in order to present the background on the biomedical topic, or any information that was presented in the presentation. Okay, I guess that's it for what I wanted to address. Do you have any questions on the PowerPoint presentation? Or if you have just any questions that you'd like to state to any of us three. You may use
MLA format.
Yeah, you may use MLA format. That's fine for referencing. Yeah, as long as they're all they're all the same.
From an OD standpoint, you want to get I mean, I understand you guys are sharing it with your partner and they've done the ODs. The thing is, one of the things that I was just sitting here thinking about it, your partner might have done the OD competency on the patient. And if you really took it from there all the way through and you're coming through and you're getting a phase 2 done, or you're almost starting the phase 2. I mean, if they have enough pictures and casts and everything is in there, you can actually use that information. But the thing is, for them to have I can tell you some of the patients that they did the OD competency, the patients never came back. So I don't want to say, I don't want to put people advantage or disadvantage. It would be nice if you had pictures. And I'm sure all of you guys have really, really interesting cases, because I've seen them at the seminars and they're really good cases. If you presented these cases at seminars, you still can present them here because it was a very informal setting that they were presented at. And you guys have a lot of excellent cases. I don't want you not to select them thinking this is impossible. It's just, I don't think a lot of you guys are thinking in those terms. The pictures and the casts are really good because I like to have them as part of the case. But as I said, sometimes you really have good cases, even in the middle of the treatment, you can get the pictures and present them. That still would be good in terms of presentation. So people like to look at pictures to have visualized what's going on. And then when you explain things, it makes it easier. So it's not an impossible situation, but it takes a little bit of thinking on your part and thinking about the fact that when you're treating patients, they're not just an amalgam here and a root canal there and a crown there. It's just a whole patient. And you do have those cases. So you just have to go and dig through them and find them.
One thing I want to point out is, while you are presenting, you are expected to have your video on as well. So while as a presenter, so for participants in the room or in the session, it's okay if you don't want to turn on your video, but if you are presenting, you have to have your video on during your presentation. So I know most of you now are hiding behind your screens, even though we'd love to see you. We miss you all. So turn on your videos and you can definitely participate in the sessions. We encourage you to participate via audio as well. So you guys are probably pros now, experts in using Blackboard Collaborate. All you have to do is click on that little person, raise your hand, and you can ask your question via audio. If your audio is not working, then you may utilize the chat to type in your question. But definitely while you are presenting, your video should be turned on. Can perio and resto count as 2 disciplines? Yes.
Yes, there are 2 disciplines. Sealant is not. That's preventative. Heads up. The biomedical topic is checked with Dr. Smoser and Slayman because they need to make sure that your biomedical topic does make sense, and you can, give you some information. So I would definitely say they need to check that for you. That I would leave it 100% up to them. Yeah, they've done it for so many years, they know what cases are good or
Yeah,
not.
I would say if it's something big, but if it's one of those topics listed on the biomedical topic sign-up sheet, then you just go ahead and sign up for it if it's obvious. Unless it's something you're not sure if it qualifies or not, that's when you would refer to us.
Yeah, you only check with us when you don't find that topic on the topic.
Mm-hmm. Can we have pictures and casts from the middle of treatment?
You can present it. I would love to have it from the beginning, so it shows the beginning and the end. But the middle of the treatment, if you've taken everything, there's nothing left to show what you started with. It makes it really hard. That's why we'd love to have pictures and the cast from the beginning, so it shows the beginning and the end, or whatever you're at. It makes sense. You can bring them up. You may not get the points because it has to be beginning of the treatment, but I think it still has some value. The patient must have the medical condition right now. I don't think if the previous alcohol abuses can be used doctors?
Mm,
No,
well,
I don't see it. No. The patient has to be in the middle of it
I
right
don't
now.
think so.
unless that patient has developed something like liver disease, Huda. Can we still sign up for a topic even though we aren't scheduled for a date yet? No, unfortunately, I don't have the biomedical topic sign-up sheets up for those dates because you want to know what date you're signed up for before you sign up for the topic.
Right. For
We'll roll
phase
it out
two,
as we go.
for phase two, I mean, RPD is a phase two. I'm not sure why people are so hung up on the RPD. I mean, you could have an RPD phase two, you could have a bridge, you could have a crown, you could have an implant. I'm not looking for, fancy stuff. Regular stuff is just fine too. No dentures. No dentures. Period. No dentures.
You mean full dentures, right?
Yes.
Complete. Yeah.
Complete dentures. No complete dentures.
Yeah, complete dentures. No complete dentures.
As soon as the schedule is given to me, I will post them, you guys. All I have is October 2nd, just like the way you have in your axiom. I don't have anything past that. I'm hoping to get them. Sorry, you guys.
Yeah. We appreciate your patience so that the schedule is not out yet for us. We usually used to have everybody's schedule out up until the end of the course.
I mean, if you did the OD for the patient, you're doing the work for the patient. It doesn't matter if they were here 5 or 10 years ago. I want to see that you've done the work for the patient going forward, and there's a beginning and an end to that. So the patient might have been 5 years ago here, went away, came back. You have a whole lot of stuff that you're going to do for them. It's still good.
Rabia is asking if they would have 2 weeks to prepare. I mean, we will post the schedule as soon as we have it.
You need to have a phase 2 component to it. Phase 1 is not acceptable, no. If you have a phase 1, that means perio-restorative, nothing is going to happen after that. So you need to have something that would be more than fillings and scaling.
All right. Is there anything else that we need to cover on the Blackboard site that I missed? Christine, do you?
Somebody's asking, my patient doesn't have a lot of phase 1. I have to look at the case. I can't tell you. Phase 1 could be 32 teeth that need to be restored versus 1 tooth. I don't know. I have to look at the case.
I think you covered pretty much everything.
Yeah.
Okay. So for specific questions about each individual case, I guess you would need to address those either with the participating clinical faculty, and I saw Dr. Anderson, Dr. Griffin, they're more than happy to work with you in selecting a case that they see appropriate and fit to for this criteria. If you have any questions about the biomedical topic, if it's not clear, if it's not listed on the biomedical topic sign-up sheet, you can contact me or Dr. Schmutzer. I guess.
So, Dr. Sleiman and I are permanent fixtures in each room. Also, we have 2 periodontists, Dr. Rodriguez and Dr. Chokshi. Yeah, that are also permanently there, and then we have a floating general dentist.
Right.
So there are always 3 faculty in each room. If you have any kind of problems related to biomedical part, it's me or Dr. Sleiman. If you have clinical, you address the question to the clinical faculty, either the periodontist or the general.
Yeah, Dr. Anderson has been doing it for many, many years, so he's been pretty good about it. Dr. Niskar has been doing it. So they're going to be, not a single person is going to be, Dr. Anderson probably going to be one of the anchor person. Dr. Niskar most likely is going to be the other anchor person, but we're going to have a slew of other faculty that if they're not involved in the clinic for Friday afternoons, they're going to be involved in the seminars. I'm usually select people that I've done in the past, so this is nothing new.
Okay. Is there anything else? Any further questions? If a POE is used in the patient,
come and see me. I don't like to pick out albums. Just come and see me because sometimes in person, you can have a better discussion than on an email. The words on the page, sometimes it loses its effect. If a POE is used and the patient was previously diagnosed with perio and the diagnosis hasn't changed, can we still use the case? Typically, POE cases are not being used for this because POE means they're in the maintenance mode. So I'm not sure why the POE would be part of this. As I said, POEs are usually in the maintenance mode. Rarely do I have a POE that only has one thing going, 1,000 things going in there. So heads up. It could be a case that you did the OD, you continue with the POE, that's okay. But for a POE that you never did anything, you just come in, I just don't see that. You still have to have some ideas about the phase 2. It cannot be, I don't know. You have to have some idea about the phase 2. So, if they have so much extensive phase 1, that could be an issue, but you should have some idea what the phase 2 is going to be like, and you have to make some decision where you're going to go, because if you don't know the end date, you're just, drowning in the water. That's all I'm going to tell you. You have to know where you're going to go, and you have to have some idea where you're going to go. Even though it's not planned, you still have to know where you're going. I'll leave that up to you ladies to make that call.
Do prosthetic joints needing antibiotic prophylaxis count as a medical condition?
I don't see that. This is already done deal. I don't know what that means at this point. I'll leave it up to you because I'm not sure.
There are guidelines about that, Stephen, already, and I think that the question you're probably having in mind to ask is already answered.
And you have to check with the newest guidelines because they changed about antibiotic prophylaxis, so you have to make sure that you know what you're talking about. But I don't really see how it's just a guideline.
Yeah, I think the question that you're trying to ask here is already established. Yeah, thank you, Lucas. See, Dr. Rose.
or Dr. Chan.
Yeah. She has strong opinions about the antibiotic prophylaxis, but yeah, I think the question that you're probably shooting to ask here is already answered. Okay, is there anything further? So for the biomedical condition, does it have to be something that would affect their dental treatment? Yes. All right. I guess, Christine, you can end the recording.
Okay.
All right. Thank you, everyone, for joining us today. We'll start seeing you next weekend. We'll see you September 18th for our first group, and then we'll see the rest of you throughout. But thank you for joining us today, and we'll have the recording posted for you as well.
Have a good weekend, everybody.
Bye.